So what we presented is actually well, part of the reason that we're presenting within at ASTCT is because this is a pharmacy SIG grant funded project. Again, like you said, looking at the application of pharmacogenomics or PGX in the supportive care of patients undergoing stem cell transplant. And then right now, stem cell transplant specifically, so this is not cell therapy. And essentially, so the underlying basis of the project and here we were presenting a status update as well. So the study is actually nearing completion, so we'll be undergoing analysis. So hopefully we'll be able to present final results come next year is the anticipation and hope. But the rationale for this project is that we do know that transplant is associated with a lot of side effects and toxicities, and there are a number of medications out there that we use to mitigate those toxicities. And unfortunately, the way that we normally practice is where through trial and error, right? So we don't have specific doses or specific medications that are specifically tailored in common practice to the specific patient. And so you may take an antiemetic, you apply standard initial dosing, patient vomits through that or has a side effect of the medication, and then you adjust and tailor the dose, or you switch medications or you add medications on depending on the patient response. So what we aim to do with pharmacogenomic-driven supportive care is see if patients have have any specific genotype phenotype, specifically looking at cytochrome P450 enzymes, single nucleotide polymorphisms or SNPs that would indicate that certain drugs should be selected for given symptoms and certain doses may be used, and those recommendations based on CPIC guidelines, which is the established genomic based guidelines that are out there. And we know that over a dozen medications on their list of roughly 40 are applicable to commonly applied to transplant. And so what our study is looking to do, one is run a homegrown genomic panel on every transplant patient who is included. So one will see the frequency, we're going to be looking at the frequency of useful SNPs for these patients. And then two, we are tailoring therapy. We're offering recommendations and tailoring therapy to the identified polymorphisms. And then we are looking at symptom assessment scores across the course of therapy to see if we can identify if we're having a meaningful or measurable impact on overall symptoms and through this PGX-driven supportive care.